what exactly type 2 diabetes is?
Metabolic disorders that are common phenotype is hyperglycemia, that is high sugar.
What exactly do you mean by insulin resistance?
It is like insensitive to insulin, not sensitive to.
What do you mean by pre-diabetes?
If the blood sugar fasting is 100 to 140, that range we usually term it as impaired glucose, impaired fasting glucose.
Is there a particular age that we need to start screening ourselves?
Even if the patient is in his 30s and he is overweight, then annual checkup is better to be done.
What about, say, your gut or your GI tract? Are these also affected?
Gut is also affected, mainly stomach is affected because of parasympathetic and sympathetic nervous system is involved.
What gestational diabetes actually means?
Baseline is increased after second trimester of the pregnancy, second and third trimester. It is called as gestational.